Hey mama, I'm Dr. Mae Hughes, a pelvic floor physical therapist, and I am 21 weeks pregnant with baby number 3. And today I'm gonna work you through a 20-minute core workout. This is the exact workout I am doing in my second trimester to support my core and strengthen it, prevent excessive diastasis, and better support my pelvic floor as my belly and baby continue to grow. This isn't just a modified workout, this is pregnancy optimized. The equipment that you will need is a Pilates ball, a medium to heavy loop band, and a light set of dumbbells. However, that is all optional and you can do this entire workout without any of the equipment, and I will show you exactly what you need to do to perform this without the equipment. Let's go ahead and get started. Meet me in all fours for a quick warm-up. Hips over knees, shoulders over wrists for quadruped pelvic circles here. It's really important to not skip the warm-up. I know a lot of people want to, as it seems really boring, but it's really necessary to mobilize all parts of your pelvis, your ribs, your spine, and your hips before you start engaging some of those muscles. Go ahead and switch directions. You're just making circles with your tailbone, imagining that there is a marker on the back of your tailbone and you are drawing circles on the wall behind you. Keeping the ribs stacked over the pelvis, trying to just isolate this movement to your pelvis. So this isn't a full body cat-cow, you're not arching your back, you are just moving that pelvis, gently engaging your core as you tuck your pelvis underneath of you. For 3, 2, and 1, stay in all fours here. Ribs are stacked over the pelvis, you're pressing your hands down into the mat. You're going to reach your left arm over to the right side body, feeling a good stretch on that left side, and just alternate from side to side. What I mean when I say keeping your ribs stacked over your pelvis is you're not allowing your chest to fall down towards the mat, and you're also not arching it up towards the ceiling. You're keeping it directly in line with the side of your pelvis. You can also add a little hip shift as you do this reach. Imagine you're bringing the side of your hip towards your shoulder or your ear on the same side. For 4, 3, 2, and 1. Moving on to a quadruped, thread the needle. Still in this all fours position, hips over knees, shoulders over wrists. Inhale, reach your left arm up towards the ceiling. Exhale, thread it underneath of that right arm. Warming up the upper back, creating space in our rib cage to allow our diaphragm to fully expand, which in turn allows our pelvic floor to fully expand. Switching sides in 3, 2, and 1. Reach that right arm up towards the ceiling. Exhale, thread the needle underneath of you. Press your hand down into the mat, finding length through the spine and that side body. For 4, 3, 2, and 1. Staying here in all fours, grab the Pilates ball, place it between your knees. We're gonna work on our deep core contraction, AKA hugging the baby. Hips over knees, shoulders over wrists. Inhale through your nose, expanding your ribs 360 degrees, allowing the belly and chest to drop, your pelvic floor and lower back to expand, and then exhale through pursed lips as if you were blowing out a birthday candle. Gently squeeze the Pilates ball and zip up your core. You're gently lifting the pelvic floor up and in, zippering up from the pubic bone all the way to your ribs. Inhale, expand. Exhale, zip. Exhale until you feel like you have no air left. Inhale, expand. Exhale, zip. This is one of the best things that you can do for your core during pregnancy to improve that deep core stability, to protect your spine, and improve pelvic floor strength. We've got 4, 3, 2, and 1. All right, moving on to our circuit. We will have 4 exercises, and we will do them for 2 rounds through. You're gonna place this small Pilates ball behind the small of your back, keeping your feet flat on the floor. We've got a ball supported march to start. Inhale into your ribs, expanding 360 degrees. Exhale, zip up that core. Notice how your belly will flatten. Keep this deep core engagement, alternating marches here. Using that pursed lip exhale to march your leg up in space without losing core tension. Keeping the neck soft. Imagine you had 2 strings or just a single string connecting one hip bone to the other, and you're trying to pull that string towards one another. It's going to help you feel that lower abdominal region engage. If you don't have a Pilates ball, you can just prop yourself up on your forearms and perform this same movement without that ball. Moving on to a bird dog, you'll grab your loop band, place it around your upper thighs in 4, 3, 2, and 1. You're gonna place that loop band around the upper thighs and grab those light weights. The band and the weights are completely optional. You could perform this bird dog without either of them. So hips over knees, shoulders over wrists. Inhale, prepare. Exhale, zip up the core. Maintain that deep core engagement. We're gonna extend opposite arm and leg, and we're gonna stay with just this opposite arm and leg for about 30-ish seconds, and then we'll switch to the other side. I'm exhaling as I extend opposite arm and leg, and then taking a soft inhale as I return to start. Not lifting my foot much higher than the height of my hip, keeping the pelvis still. Imagine you had a glass of water on your back and you don't want it to spill over. For 4, 3, 2, and 1, right into the other side. So like I said, you can perform just a traditional bird dog without a weight or a band. Make sure you are pressing that dumbbell down into the ground to keep the upper back engaged. You're lifting the dumbbell up towards the ceiling with your thumb pointed up. We've got 5, 4, 3, 2, and 1. Go ahead and remove that band. Keep a dumbbell nearby for this next exercise. We'll have an extended side plank hip lift with rotation. Once again, I will show you a modification if using a weight doesn't feel good for you at this moment. You're gonna prop yourself up on your forearm, knees are bent. Inhale, prepare. Exhale, zip the core. Straighten the dumbbell straight up towards the ceiling. You're going to exhale, lift up, and then rotate. You're threading that needle. And then return back down towards the ground. Exhale, lift, rotate, return to the ground. If you want to make this harder, extend one leg out for a little bit more of a challenge. You're driving that bottom knee through the ground. If you want to make it even harder, you can lift that top leg if that feels good for you. Always checking for any coning or doming. Switching sides in 4, 3, 2, and 1. Prop yourself up on that other forearm. Getting the dumbbell ready to go, straight up towards the ceiling. Inhale, prepare. Exhale, zip the core, lift up, and rotate. We've got about 45 seconds of work on this side before we move to the other side, or to a new exercise. Use that pursed lip exhale to help you lift up. Make sure you're driving that bottom knee through the ground as well as that bottom forearm to stay lifted through your shoulder. We've got 4, 3, 2, and 1. Last exercise of the circuit before we perform it all over again is a bear shoulder tap. So you're gonna grab that Pilates ball, place it between your knees, meet me in all fours, hips over knees, shoulders over wrist. Inhale, prepare. Exhale, squeeze that ball, zip the core, tuck your toes underneath of you, and then just hover your knees about 1 or 2 inches off of the mat. From this position, you're going to tap one shoulder, then the other, and then come back down. Inhale, relax. Exhale, zip, lift, tap, tap, come down. Trying to keep your pelvis as still as possible. If that feels too difficult for you, just stay on the ground, squeezing that Pilates ball, and just alternate tapping one shoulder to the next, or you could even walk it out to an extended plank on your knees, tapping one shoulder to the next, always checking for coning or doming at midline. And go back to that bear. For 4, 3, 2, and 1. Alrighty, that's the stair kit. We're gonna do it one more time through. So meet me back on your back, Pilates ball behind your back for that ball supported march. Alrighty, inhale, prepare. Exhale, zip the core. We're getting right into that marching. Now, if you notice any coning as you are transitioning from one exercise to the next, that is okay. It's very transient. It's a very short amount of time. But when you want to be aware of coning and prevent it from continuously occurring is during an exercise. And for those who don't know what coning is, it's this protrusion at the midline of your abdominals. And it's a sign that you're putting too much pressure against your abdominals, which may contribute to an excessive diastasis that will not heal or has a harder time healing postpartum. We've got our bird dog in 4, 3, 2, finish out your rep, 1. Go ahead and place that band around your knees. Alrighty, grab those dumbbells. Meet me in all fours. Inhale, prepare. Exhale, zip the core. Extend opposite arm and leg. Remember, we're staying on one side before we move to the other side. You always have the option to omit the band and the dumbbell. You don't need to lift the dumbbell any higher than the height of your trunk to avoid excessively arching the back. We want to keep this to our posterior oblique sling, which connects our opposite lat to our opposite glute, which helps to provide more stability to the back side of the pelvis. We've got 3, 2, and 1. Right into the other side. So your posterior oblique sling, like I said, connects the opposite lat to the opposite glute max through fascia, which is called the thoracolumbar fascia in your lower back. And by strengthening this sling, you help to strengthen the backside of the pelvis, especially where your SI joint lives. So this is one of my favorite exercises to help provide more stability to the SI joint and reduce or prevent pain there. Stick with me. For 4, 3, 2, and 1. Go ahead and move the dumbbells out of the way. I'm actually going to keep my band on for a little bit more resistance with this side plank rotation. All right, you're propped up on your forearm, dumbbells up towards the ceiling. Inhale, prepare. I'm going to extend that top leg. Exhale, zip the core. Now let's lift your hips up, thread the needle, and come back down. It's important to really get that forceful exhale as you rotate to keep the ribs in line with the pelvis. It's really common to want to flare the ribs out and puff that chest out. That's going to create more compression at your lower back and potentially contribute to that excessive diastasis or rib flare that is just a lot harder to heal postpartum. We've got about 10 more seconds. Stick with me, and we'll switch sides. In 4, 3, 2, and 1. Starting to get out of breath. That's how you know the workout's tiring. Extend that arm and dumbbell up towards the ceiling. Extend the top leg. Inhale, prepare. Exhale, zip the core. Lift up and rotate. After this, all we have is our bear, and then we get to cool down. Core strength is so important through pregnancy. And sometimes you might hear that you should stop strengthening your core during pregnancy, and that couldn't be further from the truth. Now, you might need to modify for better pressure management, but you absolutely should be strengthening your core, especially to ensure a smoother postpartum recovery. We've got 4, 3, 2, and 1. Alrighty. Going into that bear shoulder tap, I'm just keeping the band on at this point. Ball between the knees. Meet me in all fours, hips over knees, shoulders over wrists. Inhale, prepare. Exhale, squeeze the ball, zip the core. Hover the knees, tap, tap, lower. Tap, tap, lower. You're keeping your core engaged the entire time you are hovering and tapping, trying to shift your pelvis as little as possible when you tap. We got about 15 seconds of work left. We've got 4, 3, 2, and 1. I hope your core feels as strong as mine does right now. We're going to cool it down. Once again, an essential part of a workout that a lot of people like to skip over, but it's really important to down train your pelvic floor and core and relax it after a workout. Meet me on your side to start for a windmill. Bring the knees in, bent towards the chest, hands out in front of you. You're just going to windmill the arm up and over, feeling a good stretch through the abdominals and the chest. Another myth that you might hear during pregnancy is that you shouldn't rotate. Once again, that is also a myth. Your body needs rotation. Go ahead and switch sides after your rep. Rotate up and over. You might notice you feel more stiff on one side compared to the other. That is totally normal. For 4, 3, 2, and 1. Roll onto your back for some knee to chest circles. You're gonna bring those knees in towards your chest, hands on top of the knees, and just make circles with your knees on the ceiling, going through whatever available range of motion you have. If you're experiencing any low back or SI joint pain, I want you to place a pillow underneath of your booty. Go ahead and switch directions. And that's going to help get you into a little bit more of that posterior pelvic tilt and reduce some of that lumbar spine compression. For 4, 3, 2, and 1. Place both feet on the ground, arms up to a T or cactus position. Windshield wipers here, just allowing your knees to fall to one side and then the other. Maybe gently tuck your pelvis underneath of you if you're experiencing that SI joint or lower back pain, or just place that pillow underneath of you. For 4, 3, 2, and 1. Finishing off with left side body breathing. So you're gonna roll onto your left side specifically. You're going to extend the top arm and leg long. Bottom knee is bent. Inhale into your top ribs here. And exhale, let it go. Inhale, expand. Exhale, let it go. Continue inhaling and exhaling at your own pace, focusing on expanding the ribs up towards the ceiling and down and towards the mat. The reason why we focus on the left side or laying on our left side to get more expansion on the right side is we tend to, just as human beings, crunch down more on the right. And so finding this right side body expansion becomes even more important during pregnancy. Use your hand for a cue if you need. For 4, 3, 2, and 1. Congratulate yourself on making it through this 20-minute core workout. I know I said this is for the second trimester, but you can really do this at any point along in your pregnancy journey. If you found today's workout helpful, you will love my Movement Through Pregnancy program, which is a 37-week prenatal program, follow along workouts for every single week of your pregnancy, and I will include a link for it in the description below. And don't forget to leave a comment, like, and subscribe to this channel so you never miss a video.